मेरे
Shall we start, Dr. Sushma?
Yeah, let me share the screen, then we can start. Am I audible?
Yes,
Yes,
ma'am, you
Harshita,
are
ma'am.
audible. Harshita, ma'am, just give me 2 minutes to introduce you.
Sure, ma'am.
Yeah, yes. So, good afternoon and a warm welcome to everyone. Today, we are excited to host this important webinar on menstrual health and hygiene, organized by Hermann Miner Center of Excellence in collaboration with Global Hunt Foundation. We are honored to have Ms. Harshita Upadhyay, an expert in menstrual health, as our key speaker. She is an accomplished educator with a master's degree in physics. She is also a member of Global Hunt Foundation. She conducts informative sessions on various crucial topics. She is empowering students with essential knowledge and breaking down the societal taboos surrounding menstruation. Thank you, Ms. Upadhyay, for sharing your valuable insights with us today. We are also delighted to welcome Dr. Mukta, the principal of Hermann Minor Degree College and the principal of SOS Nursing College. Your presence here today underscores the importance of this initiative, and we truly appreciate your support. To our participants, I encourage you to engage actively and make the most of this session. This is a great opportunity to learn and empower yourself. Thank you. Let's begin the session. Over to Ms. Harshita.
Okay, ma'am. Thank you for the
Thank
introduction. So,
you,
yeah,
ma'am.
I'm Harshita, and this session is about menstrual health and hygiene. And this session is conducted by Unicharm. You can see Unicharm logo on your screen. So, what is Unicharm? Unicharm is a Japanese MNC which started in India in 2008, and since then they are manufacturing hygiene products, especially in three categories. So, the first category is baby care category, in which they are manufacturing baby diapers named as Mammy Poco Pants. The second category is feminine hygiene, in which they are manufacturing Sophie sanitary napkins. And the third category is adult care category, in which they are manufacturing adult diapers named as Life Free. So this is about Unicharm. Let's move on. So, girls, you know that you all are different, right? You are different in so many ways. Just like we are different in body type, like, dislike, thought process. right? So as we are different, in similar way your periods can be different, right? As you all are different, right? In similar way your periods can be different, and don't compare your period. It is totally fine if you are experiencing different thing during periods, because some experience abdomen pain, some experience acne pimples, some experience mood swings, right? So we have different experiences during period, but that is totally fine. But the thing is, we need to understand what is right period and what is regular period. Okay, girls, please be muted. Yeah, so we will understand in this presentation what is a regular period and why regular period is important, like why your menstrual health is important. So we are doing these kind of session just because in India period is still considered as a taboo. No one talks about it openly, right? So we want some platform so that you guys can talk about periods, you can interact, like whatever your queries and doubt you can ask in this session. So that's why we are doing these kind of sessions, so that we can give you like important information about your menstrual health and hygiene. So that's why we are doing these kind of session, and this is an interactive session. You can ask anything at the end of the session, like regarding the session and regarding your menstrual health, you can ask anything. So yeah, at the end of the session you can ask. So then this is about adolescence. So adolescence is the time when your body will change physically, mentally, and some behavioral changes are there. So we experience physical maturity, right? Mental maturity, and there are some behavioral changes. By all these changes, uh, we become like going through all the changes in adolescence time, you will enter into adulthood. So adolescence time is a transition period in which your body and in which a child body matures into an adult body. So initially you experience some physical changes, like in initial period from 10 to 13. After then you experience behavioral changes, right? And then your body will look like an adult body. So in behavioral changes, right, what kind of behavioral changes? Because physical changes, your height will increase, right? Body changes, breast development will start, you will experience periods. So in behavioral changes, what kind of behavioral changes? Just like in this age, in middle adolescence, your emotion become very strong, right? And like mood swings are there. You are more close to your friends because you feel comfortable with them. So this is the time when you feel like that we are mature, right? Your body is maturing, and children feel like that they are matured physically and mentally. As you are growing physically, you feel like that we have full mental maturity. But this is the age, this is a very important age, right, in which anyone can influence you, right? You are not fully matured. You will get the full maturity in adulthood time, like between 18 to 21 you will get the full maturity in your adulthood. So now you can take responsibility, now you know what is right and how to take decisions. So it is important to understand that the middle adolescence is not the time when our body is fully matured. Then why the changes are there, why we experience physical changes, behavioral changes? Just because of hormones. As we all know, because of hormones, we experience changes at the time of puberty, right? So hormone releases from our body, and we experience changes. So in girl body and a boy body, different hormones releases. That's why the changes are different, right? A girl body is different from a boy body just because of different hormones. So in a girl body, testosterone, in a girl body, progesterone and estrogen releases, and in a boy body, testosterone releases. And because of different hormones, we can say girl experience like breast development, her first period will start, and the pelvic area become widen. In boys, we can see because of testosterone, shoulder area become widen, voice deepening will start, right? Facial hair growth will start, like beard and mustache. So growth in their genital area. So these are the changes, uh, different changes just because of different hormones. And there are some common changes, as we all know, common physical changes: acne pimple, increase in your height and weight, body hair. So these are some common changes. After then, behavioral changes. So along with the physical changes, you also experience behavioral changes at the time of adolescence. What kind of behavioral changes? Just like I told you, mood swings, right? And your emotion become very strong, so you become very emotional and sensitive. So in this age, like sometimes we feel like that on a very small thing you react a lot, right? This happened in this age, and after then we realize I should not react that much, that this was not a big thing. So but it happened just because of hormones, right? Hormones are releasing in from your body, and that's why we also experience like that, our emotions becoming very strong. So it is fine, but you need to understand that if you are feeling emotional and sensitive, it is totally fine, it is totally normal in this age. And uh, if you are feeling emotional, then you need to express yourself, right? You need to express your emotion. Don't suppress your emotion, right? It is important, like we express ourselves and also create a positive space around us, so that people can express their feelings, right? They can express their emotions. So it is important, because generally we judge people while they are expressing their self or expressing their emotions. For boys it is difficult to express their emotions, right? Because it is a thing in our society, like boys should look strong, they can't cry, right? So because of that, they just suppress their feelings, right? It is not like that only boys can be strong and girls are very sensitive, that's why they start crying easily. So it is not a right thing. Crying is just an emotion, so don't divide it on the basis of gender, right? So it is important we understand that we are just expressing our emotions, right? So it is not a gender thing, right? We need to cross the barrier which is caused by gender, like gender stereotype. You need to cross the barrier. This gender stereotype is a kind of barrier in our society. So it is important, like, so the same thing, like if someone become someone like feel emotional, then we need to tell them it is totally fine. If you want to express or if you want to tell anything, you can tell, like feel comfortable. Don't judge people and don't say them like if you are crying then you are weak, right? Don't say this, like if you don't like, generally we just compare or relate, we just relate these two things. If you are crying you are weak, and if someone is not crying, he or she, like they are strong. So it is not like that. Don't merge these two things, right? You are crying, then also you are strong. So just be kind with yourself, right? If you, it is important, like we are becoming like kind with ourselves, so that we can be kind with other people also. So express your feeling and also create a positive environment around you, right? A positive space around you, so that people feel comfortable while expressing their self. Then peer pressure. So peer pressure is a kind of pressure you feel at the time of adolescence. Like it is a kind of pressure when your peer group is doing something and you have that pressure on yourself, right? Suppose your peer group is doing peer group, or I can say your age group people, right? Or your classmates are doing something and you have that pressure on yourself, right? Every girl in your class uh, is wearing heels on sari, then you have that peer pressure. Everyone is doing that, I have to do that, either you are comfortable or not. Or any activity, like anything, your classmates are doing anything, you have that peer pressure, like everyone is doing that, I have to do that. So don't take any peer pressure, because there's no need to take any peer pressure to fit in some particular group, right? It is totally fine, you are different, right? We all are, like I can say, individual. We have choices, so it is fine if you don't want to do something which your peer group is doing. So don't take any pressure, don't force yourself to fit into something for which you are not made, right? So it is fine, don't take any peer pressure. Then mood swings. So mood swings, when your mood changes frequently, right? Sometime you are good, just happy, joyful. After some time you are angry, sometime irritated, excited, nervous, sad. So these are different moods, and we experience mood swings at the time of adolescence. And in girls, Like you also experience mood swings at the time of periods. So it is not an adolescent thing only. This also happened at the time of periods. So in every period we experience a major mood swings, right? We easily get irritated, we easily get angry during period, just because of hormones. Every month, because of periods, you experience hormonal changes, right? So along with the adolescence time, you also experience mood swings at the time of periods. We call it PMS also, premenstrual syndrome. So after then, being conscious about self. So as you are growing, right, you like become over conscious about your body. So you start worrying about your body, your looks, your height, everything, right? So it is fine if we have like basic like consciousness about our body hygiene, like everyone want to look good, and that is fine. But don't be over conscious about your body, like that much that you start comparing your body with others, right? It is not a right thing, because as I told you, we all are different, we have different body types, right? So it is fine, we all will get different body type, different height, right? So don't compare yourself. What you can do, so you can work on your fitness, you can work on your lifestyle. But sometime it happen just because of society pressure, like a girl should look like this, girl should have long hair, or like so many things. So people expect, right? But don't be conscious about your body, and don't start comparing yourself with anyone else, because there is no ideal and perfect condition, or I can say perfect person, right? Or a perfect girl. There is nothing like that. We all are beautiful in our own way. So we all are perfect, right? And no one is perfect. So understand this, and don't be conscious about your, like over conscious about your body. Like when this acne will go, will I get this much height, will I reduce my weight, or will I gain more weight? So don't be conscious about your body and all these things. Just work on your fitness and your lifestyle. And also, like if you really want to, like you feel like that, what is attractive, right? So you need to understand that not your looks are attractive, right? Your confidence, your skills, your knowledge. And if you are a good human being, you are helpful, you are kind. So all these things are attractive. So develop a overall personality, work on your personality, not on your like only looks, and on your just like on your looks, right? So I think you all will be fine. You all are growing, and like you will grow fine. So don't be conscious about your body. And then it is about reproductive phase in women. So the first thing a girl experience at the time of puberty is white discharge. So white discharge is a sticky fluid which comes from our vagina. And after like white discharge, like within a year, a girl get her first period. So after her first period, her period will continue till menopause. So menopause is the age when a woman ceases to menstruate, or I can say menstruation will stop at the time, right? So before menopause, like before coming to menopause, we will discuss about menstruation. So like menstruation is the process, like when you get your periods. Hmm. So after getting our period will continue, and that is called menstruation, right? And menstruation or periods. What is regular periods or regular menstruation? So if you are experiencing period after a fixed number of days every month, and those number of days coming between 22 to 40 days, right? The one thing. The second thing, the bleeding days should be same for every month. And it is coming between 3 days to 7 days. Then we call it your periods are regular. Okay, otherwise your periods are irregular. If you don't know like when my period will come, and like it's coming irregular, or it's coming in different number of days, like different cycles, then that is not a regular period. And also, like your bleeding days are not same. Sometimes you bleed for 4 days, sometimes 6 days, sometimes 7 days. So that is not a regular period. So your bleeding days should be same for every month. And the number of days after which your period repeats should be same. Like suppose my menstrual cycle is 29 days, and every month I get my periods after 29 days, and also like bleeding days are 5 days every month, so I can say this is a regular period. Then menopause. So as we start our period, like initial 2 years your period will be irregular. Okay, in similar way, like when periods stop, it is not stop suddenly, just it will stop, and it will not come again. It is not like that, right? So menopause is the age, like it is from 45 years to 55. So in a woman, period will stop between 45 to 55. So it will not only like next menstruation it's not coming, like I'm not experiencing bleeding and that's it. It is not like that. It will again, like at the time of, like as it start, it's irregular. In similar way, when it stop, it again become irregular, and then it will stop. So you experience 3 4 years like irregular periods. Sometime your period will come in 15 days, sometime 2 months, sometime 3 months, right? So menopause is the time when you experience irregular period. Like it is the first, the age is 45 to 55. It is a normal age of menopause. So your period will stop between 45 to 55, or it will not stop suddenly. Initially it will become irregular, and then it will stop. So not only irregular period, there are some other effect of menopause. So just like girls, please be muted. So yeah, there are some other effect of menopause, just like mood swings. You experience mood swings. Yeah. You experience mood swings at the time of menopause, sleep disturbance. You experience like night sweats, like you experience like in the morning a lot of sweat in your body, and you experience hot flashes, vaginal dryness. So there are so many other effect, weight gain. So we can understand that there are so many effect of menopause. It means menopause is not a very comfortable situation for a woman, because they have like work responsibility, family responsibility, and also there a lot of going on with their body, right? So as like we understand, like if you don't know, then you know now like what is menopause. So if your mothers or elder ones who are in this phase, then make them feel comfortable, just spend time with them, ask them like if you need any help, I'm here, right? Just sit with them, and just be little sensitive towards them, because you need to understand that a lot of going on with their body. They don't feel comfortable all the time, like hot flashes are there, a lot of sweat is there. So like with the family support, they can easily go through the menopause phase. So it is important we all, like family members, be there for like your mothers or anyone who is in menopause phase. So it is important to understand about menopause, and also like tell them let's visit a doctor, because it is very important at the time of menopause a woman visit a doctor. Then there are two other type of menopause: premature menopause and late onset menopause. So when menopause come like early in the mid 40s, like it is if it come before 45, it come like close to 40, then it is called premature menopause, right? So this is not the right age of menopause, but just because of your body is not releasing enough hormones, right? That's why it come early in some women. So there are some like reason for that, there are some causes for that, like enzyme deficiency, thyroid disorder. So if you have thyroid disorder, then it can come like early or late, right? If some surgeries or some radiation therapies are performed on your body, then those can be the reason for like premature menopause. And also like late onset menopause, when menopause comes after 55, then that is not again normal age of menopause. So it is just because of obesity, thyroid disorder, and if your body releasing more hormone, right, than usual, like high level of estrogen in your body, and genetics also could be the reason for late onset menopause. Then this is a female reproductive system. Because of this system only a female can give birth to a baby. So you can see like this is right below our navel button, and let's see the functioning of the reproductive system. The central part is uterus, the pear-like structure which is made up of blood linings, right, which is called endometrial lining. The wall of uterus is made up of thick wall of uterus is made up of blood linings, endometrial linings. And you can see ovaries releases eggs every month, and those eggs travels through the fallopian tube inside the uterus. If the egg is fertile, then it will convert into a baby, and the uterus walls gives nourishment and nutrition to the baby. And you will not get your periods till 9 months, right? And if the egg is not fertile, then the unfertile egg, when unfertile egg comes into the uterus, that is no use of uterus. So what uterus does, it just throw the unfertile egg from your body through the vagina, and also those blood linings, there is no use of those blood linings at that time. Like the use is only when the baby is inside the uterus. So now those blood linings are also not useful, and those also shade out from your body. So those blood linings breaks or shade out from your body through vagina, and that is your periods. So every month, like after your period, uterus prepare new blood linings, and every month at the time of period, the blood lining shade out from your body. So this cycle continuous. Then menstrual management. So you need to manage your period. You need to track your period every month. Just because if we track our period only, then we get that our periods are coming regular or not. So it is important like we track our period regularly. There are so many period tracking apps available. So you can download the apps, and you can just assign your period dates in your app. And also like in simple way you can mark on your house calendar. So in any way you can just track your period. So first thing, you need to mark your period every month, and then check last 3 or 4 months my periods are regular or not, right? Because irregular period means you may have some problems in future, like you may have some diseases like pcos, thyroid disorder, diabetes, PIV, fibroids. So it is important we understand that our periods and our menstrual health is important, right? If your periods are coming regular, it means your menstrual health is fine. But if the first sign, like your menstrual health is not good, is your irregular period or missing period, right? So delayed, early, or irregular periods is like I can say it's not a good sign that your body, your reproductive system, or your hormones are releasing properly, right? So that's why we need to track our period. Then when to consult a doctor, so you need to consult a doctor in irregular period first thing. And if you are experiencing like heavy blood clots during period and a lot of pain, right? So at that time also, this is also like not a normal period, because small blood clots and initial like days you experience, but only you are experiencing blood clots, big blood clots, heavy blood clots, it means that's not a normal period, then not a regular period. You need to consult to a doctor. And also if you are experiencing like a lot of pain during period, you can't get up from bed, you can't walk, right? So this is also not normal, because in endometriosis also it happened, you experience pelvic pain. So in endometriosis what happened, your uterus just prepare the lining similar to your uterus, and which is also grow outside the uterus. So that is called endometriosis, right? So the similar lining to our uterus lining grows outside the uterus. So in that time also we experience pelvic pain. So it is important, if you are experiencing first thing irregular period and a lot of pain during period, right, and heavy blood clots, so all those are not normal during period, so you need to consult a doctor. If you are experiencing a lot of white discharge and vaginal irritation, itching, then that is also not a normal like normal white discharge, because we all experience white discharge just before and after period, a little bit white discharge, and that is normal. But if you are experiencing a lot of white discharge, that could be bacterial infection, so it is better you visit doctor on time. And at the time of menopause you need to visit a doctor. Then it's about dysmenorrhea, pain during period, like menstrual abnormalities. The first one is dysmenorrhea. So dysmenorrhea means pain during period, and like we experience abdomen pain, back pain, thigh pain, bloating sensation, acidity during period. So the cause is when, like at the time of periods, your uterus contracts strongly, and because of the strong contraction in uterus, it pressed the nearby blood vessels, and that's why the oxygen supply inside the uterus stops and we experience pain. So this is the like reason for pain. And bloating and acidity, just because of fluctuation in your hormones at the time of period. So water retention increases in your body, and that's why we feel bloated, and like we also feel like acidity during period. So all just because of hormonal fluctuation. And irregular period, so irregular period, as I explained you what is irregular period, and the main cause for the irregular period is like poor lifestyle, right? What comes under poor lifestyle, like if you are drinking, excessive drinking, or smoking, or don't take proper diet, right? Your diet is poor, you either you are doing over exercising or not doing any physical activity, if you have high stress level, right? And if you have PCOS problem or thyroid disorder or fibroids on your uterus lining, then these could be the like reason for the irregular periods. Then PCOS, polycystic ovarian syndrome. So, what is the cause for PCOS? Right, nowadays we like experiencing PCOS. Girls are experiencing PCOS, PCOD, um, like more. So, what is the reason for that? So, the main reason is hormone imbalance in your body. Right, PCOS also happened just because of that, and PCOD also happened just because of that. So, for PCOS, let's talk about PCOS, polycystic ovarian syndrome. So, when your body releases more male hormone, right, then it affects the development of eggs in your ovaries, and eggs converted into cyst. Okay, so this is the reason for, because our body releases like little male hormone, that's why we have facial hair growth, little bit facial hair growth. But when your body start releasing a lot of male hormone, androgen, then that is the problematic thing, right? That's why they just affect the development of eggs, and eggs converted into cyst. That's why the name is polycystic. Many cysts develop in our ovaries. And the symptoms, so the symptoms are like, as I told you, male hormone releases a lot, so male pattern of facial hair growth. Normal facial hair growth we have, but if you are experiencing abnormal facial hair growth, male pattern of balding, weight gain, acne, pimple, heavy bleeding during period, so these are the symptoms for PCOS. And in PCOD, like also uh, it is also happen just because of hormonal imbalance in your body. So in that case, your body releases immature eggs, so then eggs converted into cyst, so that is PCOD. In PCOD also, the cysts are developed in your reproductive system, so that is also like problematic. So both are just because of hormonal imbalance in your body. Then there are some simple yoga exercises suggested during period, and also you can do those in non-period days. The first one is Vajrasana. Um, you should just sit in this pose. It is very simple. You can see the pose on screen, Vajrasana. So just sit in this pose for 3 to 5 minutes and repeat it for 3 to 5 rounds. It is very good for our digestive system, right? So during period also we experience some stomach troubles. So we should do this asana if your body is allowing you. It is very simple exercise. So it reduces stomach troubles, and it is also strengthen our pelvic muscles. Then the second one is moon pose. So this is again a simple exercise. Just you are sitting in Vajrasana and just stretch your body. Um, and touch your hand to the floor, so you can see the how to do this. So just do the moon pose. It is very good for your to give stress to your upper body. And the second thing, it is very effective in mood swings because it cool downs your brain and it reduces anger. So we experience we feel irritated and angry during periods, right? So by doing this you experience little calmness. So it is better if you try this during period. But if you have high blood pressure problem or slip disc or increased eye pressure or vertigo, then you should avoid this. Then the third one is cat pose. So this is again a simple exercise. It is good for flexibility of spine, neck and shoulder, and also good for toning your reproductive system. Then risk and prevention. So during periods you need to change your sanitary napkin after every 4 to 5 hours, because when the period blood comes in contact with the air and water, then bacteria develops in it, and to prevent bacterial infection you need to change it after every 4 to 5 hours. Then there are some product available in the market like Sophie antibacterial to prevent bacterial infection, and the Sophie Cool, you can use it during summers. It gives cooling effect. Tampons and panty liners. So tampons are cylindrical shape applicator, and you need to change it after every sanitary napkin only after every 3 to 4 hours. So every time you need to use new tampon. And panty liners are for white discharge days. These are small and thin pads, so you can use those. And then feminine hygiene management. So how to manage your hygiene? So as uh, you all are college student, you already know how to maintain your hygiene. But one important thing I want to tell you is don't use anything on your vaginal area, your genital area. It's a self-cleaning organ. There is no need to apply any wash, any soap, any fragrance cream there, right? Because there are so many product available in the market, right? So vaginal wash and so for vaginal wash, right? So don't use, because there is no need. But if you have some infection and doctor is suggesting some particular product, that is a different thing. On the daily basis there is no need to apply anything on your vaginal area. And if you use public toilet, then always flush before and after. And there is, if there is an option of Indian toilet, try to use Indian toilet because there are less chances to get infected. So we generally get urinal infection after using public toilets. So it is important either we carry some spray for just to kill bacteria on the toilet seats, or just flush it before and after, and just clean the toilet seat and then use it, right? It is important to for hygiene purpose. Then healthy lifestyle. So it is very important to maintain a healthy lifestyle because the main cause for irregular period and bad menstrual health is poor lifestyle, right? These days, we are not maintaining a good lifestyle. We are eating out a lot, right? You are not eating home cooked meal, nutritious food, right? Packaged food, cold drinks, caffeine, junk food, like processed food we are eating like a lot of time. So this is the thing. One thing, your eating habits are not good. Second thing, your sleeping pattern is not good. Third thing, you if you have any stress, you are not doing anything for that, right? And also the fourth thing, you are not doing any physical activity, right? Either you are doing one or two things, but still like there are a lot of things we need to do together, then we can say we are maintaining a good lifestyle, right? So for good lifestyle, first thing, have home cooked meal, avoid the food outside. So have like dal, rice, chapati, green veggies, salad, right, in your meals. And also like don't skip your meal, right? Have food on time, breakfast on time, lunch on time, dinner on time. So this is important, like we eat on time and we eat healthy, right? Have milk every day, have fruits every day, stay hydrated during periods. Also, if you are not in mood to have anything, you should have small meals, right? Don't avoid your meal. It is important, like we have like something in our breakfast, just like have banana shake, apple in your breakfast, small portion of rice and dal in your lunch. So it is important like to have something rather than skipping your breakfast and meals. Then physical activity. So every day do some physical activity for a minimum 1 hour. If you don't have time, then you can just reduce it up to 40 minutes, but minimum like 40 minutes to 1 hour every day we should do some physical activity, right? You can do anything, whatever suits you. So just like you can do swimming, cycling, yoga exercises, dance, any sports. So running, anything like. So just be active. And sports are very good. You can play sports, then also like you are doing some physical activity. So do anything, but at least you should do like 40 minutes to 1 hour every day. And your sleeping pattern should be right. Sleep on time, wake up on time, have minimum 7 hours sleep. And then like if you have any kind of stress, right, then you need to do some meditation, breathing exercises, pranayam. So it is important. We can't say this, I have stress and a lot of things are going on in my life, right? But still, you are the only one who will take care of your body, right? So you need to work on your body, and it is important, right? Because on the right age we start working on our body, we start working on our lifestyle, then like it is beneficial for us, right? We will not get diseases in future, our hormones stay balanced. So it is important, like your lifestyle is very important. If you have any bad habits, you need to stop that. So, and the screen time, reduce your screen time. If you use like a lot of screen, then you need to just shift that time into your physical activity. So because we are just becoming lazy, and we are just becoming addictive by social media, and using like mobile phone or laptops for long hours, right? So it is important we know that how long we need to use screen. And yeah, I think all these things, uh, do some pranayam and breathing exercises for to keep your mind calm. It is important. So yeah, we can do all these things to just maintain a healthy lifestyle. So yeah, that's it from my side, students. If you have any queries, you can write it in the chat box, or just unmute yourself and you can ask. Feel free to ask any question regarding the session or regarding your menstrual health.
Good afternoon, ma'am.
Good afternoon. Yeah, tell me, Chetna. You want to ask?
Yes, ma'am.
Huh.
Ha- I would like to know that how many days of the cycle is normal? Like 3 days, 4 days, 5 days, or 7 days?
Between 3 to 7 days, but every month it should be same. Like we all are different, all can have different like bleeding days every month. Just suppose I have 5 days bleeding, I experience 5 days bleeding every month. It is coming between 3 to 7 days, and it is same for every month. So like whatever days you bleed, 4 days, then every month it should be 4 days. But you if your bleeding days are less than 3 days and more than 7 days, then we can say it is not a normal period. It is not a regular period. Minimum 3 days bleeding should be there in anyone's period, right? Minimum 3 days and maximum 7 days. But it should be same for every month. If you bleed 3 days every month, then it should be 3 days every month, like that.
Okay, but for me it is a bit different. Like for 3 days it's normal,
Hmm.
but the day after that, like there is no bleeding, and after three to like it's fifth or sixth days,
Hmm.
day again it is like some clots are there, so it's a bit like uncomfortable and quite confusing. That what
Okay,
should I do?
fourth day you don't experience any bleeding, right? No spotting also.
No, nothing, not at all. But
Because generally it happened like 3 days
seventh
bleeding,
day,
then fourth, 5th days we experience spotting, like it's like periods is going, and it's about to end. Like spotting is like it's about to end. Like initial days we experience bleeding, and like in ending days we don't experience that much bleeding. That is normal. But if you are saying if you don't experience any spot after like 3 days, and again after like 2 3 days you experience spotting, right?
Would
yes.
request all of you to open your cameras, please. Please open your cameras.
Ma'am, cameras
Please
as
be
well?
visible. Please be visible on your screens.
Yeah, so that is Chetna, that is not normal if you experience bleeding like after like your periods. It is almost like after 3 days. Please, Chetna, mute yourself. Okay, yeah. So it is not normal. Like continuous bleeding is we can say regular period, but you need to visit doctor once. If it happened like 3 days bleeding, again no bleeding, and then again you are experiencing spotting, then it is not normal. Once you need to visit a gynec. So yeah,
Okay,
once
thank you, ma'am.
discuss it, once explain the condition with the doctor, and they will guide you.
Okay, ma'am, thank you so much.
You are welcome.
Thank you, ma'am.
Thank you, ma'am.
Anyone else who want to ask anything?
Nowadays, very young girls, like 13, 14 years old girls, are suffering from PCOS and PCODs. What should do they to cure themselves or to keep themselves on safer side?
If they are suffering like PCOS and PCOD at very young age, it means it is one thing lifestyle problem. Second thing, it could be like genetics, like because of genes it can also happen because of the hormonal imbalance in parents, could also the reason like it's happening in kids also. So yeah, they need to visit a doctor at the time to reduce it, like to maintain a good lifestyle. It is important like we eat, but it is very difficult these days to eat healthy. we need to explore a lot to just find the right product, organic product. So it is difficult these days, I understand. Even the milk also we are getting, it is they are giving extra hormones to the cows and buffaloes, and then they are generating meals, and we are getting those packet foods and milk. So it is like also affecting the product we are having, also affecting our lifestyle, also affecting our hormones. So it is just because of in cities, like in metro life, we see these things a lot as compared to rural life and rural lifestyle, because they are getting things directly and we are not receiving the organic things. So that is the I can say one of the reason. So we can just try to have organic things. So I know 100% we can't do while living in a city and just living the city life. We can't switch into organic things, but yeah, we can try. So the main thing, and also improve your lifestyle, we can do this. So lifestyle is important, like at what time, how many hours they are using screen, and even the parents also using screen, because it if you are if parents are using screen, then the children will use screen definitely. So the parents
Yes.
lifestyle also affect the children lifestyle.
Any home remedies to balance hormones, if you
Home
know?
remedies like pranayam, breathing exercises are very good thing, I can say, by which we can keep our mind calm, and your hormone also will get balanced after doing pranayam and breathing exercises. So meditation and breathing exercises are very good for your hormones, because at that time your mind is calm. So we need to do this because of stress, because of all the time your mind get busy, every time there is something in our mind. So it is important we do some breathing exercises every day, so that is very effective.
Thank you, Harshita ma'am. Anyone wants to ask any question? Please, you are free to ask. Feel free.
Ma'am, I do have one more query.
Yeah, please. Please.
Actually, Harshita ma'am, you told earlier that we should not use any like जो भी हमारे पास vaginal washing के लिए products आ रहे हैं,
Hmm.
but still we need to disinfect that particular area because that is so very sensitive. And
Okay.
अब समर आ रहा है तो फिर अब और ज़्यादा because it is so very sweat over there, so we need to have like some sort of things to keep that area like unaffected and clean. So what should we do? We can use V wash.
uh, Okay, okay, Chetna, yeah, mute. So, you are saying in summers you need to use some vaginal wash product, but in general, your vagina is self-cleaning organ. You feel like that, then wash it like 2-3 times. Change your undergarments 2-3 times in a day. We can do to maintain our hygiene during summer, but it is not a solution. You are using the wash because this changes the pH level of our vagina, right? So it is not always right. If it is infected, if your vagina is infected and doctors are suggesting use that product to balance the pH of your vagina, then that is a different thing. On the daily basis, on there are so many product available, but there is no need, right? We feel like that for hygiene purpose, we sometimes we feel like that we should also use that, there are so many advertisement. So I think we should use that, we get influenced by that, but there is no need. In general, there is no need. If you are feeling like yeah, there is irritation or itching all the time, then you need to visit a doctor once. What doctor suggests, like is there any infection, if your vagina is infected, then only you need to use products over there, and also under the guidance of medical expert. खुद से ही नहीं करना है, डॉक्टर बोल रहे हैं तो दैट इज अ डिफरेंट थिंग, है ना। और वो जो प्रोडक्ट सजेस्ट कर रहे हैं वो अलग बात हुई, बिकॉज मार्केट में तो देर आर सो मेनी प्रोडक्ट्स, है ना, तो बहुत सारी ब्रांड्स है, बट डॉक्टर को पता है कि मेडिकली अप्रूव्ड कौन सी ब्रांड है तो कौन सा यूज करना है। सो दैट इज अ थिंग कि आपको लगता है कि टू मेंटेन हाइजीन इट इज इम्पॉर्टेंट टू लाइक यूज समथिंग, तो सिंपली आप वॉश करो 2-3 बार प्लेन वाटर से, ल्यूक वार्म वाटर से कर सकते हो। एंड या अपने वही कर सकते हैं हम कि अंडरगारमेंट्स आप 2-3 बार चेंज कर लो इन अ डे। यू कैन समर्स में तो आपको और ट्वाइस इन अ डे चेंज करना चाहिए फॉर योर हाइजीन पर्पस।
Okay, thank you, ma'am.
या ओके चेतना, एनीवन एल्स? We have 2 minutes. If you have any query, please write it in chat box fast or unmute yourself and just ask.
Excuse me, ma'am.
हाँ ईशा,
Ma'am, what are the options? What are the options to clean the vagina? हम अपने vagina को clean करने के लिए options क्या हो सकते हैं?
ऑप्शन अगर डॉक्टर आपको कुछ, अभी मैंने वही एक्सप्लेन किया है कि वजाइना को क्लीन करने के लिए कुछ भी ऑप्शन नहीं चाहिए, सिर्फ प्लेन वाटर से ही वॉश करो आप, सिर्फ प्लेन वाटर से, या फिर थोड़ा सा गुनगुना पानी, ल्यूक वार्म वाटर यू कैन यूज। अदरवाइज देर इज नो नीड टू यूज एनीथिंग। आपको हाइजीन के लिए लगता है कि मुझे कुछ करना है तो आप अंडरगारमेंट्स आपके दिन में 2 बार चेंज कर सकते हो, और फिर इन्फेक्शन जैसा कुछ लग रहा है तो फिर आप कुछ यूज करो, वो भी डॉक्टर के गाइडेंस में। Like doctors are suggesting something like use this product for this long, this much like time, है ना, how long you should use, doctor will suggest you। अगर कुछ यूज करना है तो अपने से खुद से कुछ भी यूज करने की जरूरत नहीं है। अगर बहुत वाइट डिस्चार्ज हो रहा है एंड यू आर फीलिंग लाइक एक्सपीरियंसिंग ईचिंग एंड इरिटेशन ओवर देयर, बहुत ज्यादा स्मेल आ रहा है आपको आपके वाइट डिस्चार्ज में, तो दैट इज अ डिफरेंट थिंग। हो सकता है तब कोई इन्फेक्शन हो, तो बहुत फ्रीक्वेंट और बहुत ज्यादा वाइट डिस्चार्ज जब आता है तो बैक्टीरियल इन्फेक्शन होता है, तो उस केस में आपको कुछ यूज करने का जरूरत पड़ता है, एंड दैट इज ऑल्सो लाइक अंडर द गाइडेंस ऑफ डॉक्टर। अदरवाइज आपको नॉर्मल हाइजीन मेंटेन करना है तो जस्ट वॉश इट विथ प्लेन वाटर लाइक 3 and 4 times a day, and also change your undergarments twice a day. That is the thing you can do to maintain your hygiene, vaginal hygiene.
Ma'am, excuse me, ma'am. Ma'am,
Yes,
हाँ जी
Isha.
ईशा बोलिए।
मैम जब हम प्यूबिक हेयर हटाते हैं तो उसके लिए बेस्ट ऑप्शन क्या है? इरेजर है कि हम वैक्सिंग भी कर सकते हैं वैसे रहना?
रेजर ही बेटर ऑप्शन है वैक्सिंग से थोड़ा सा, बिकॉज प्यूबिक हेयर आपके बैक्टीरियल इन्फेक्शन को अवॉइड करता है, तो प्यूबिक हेयर आपको लगता है बहुत ज्यादा मेसी हो रहा है तो आप क्लीन करो, अदरवाइज प्यूबिक हेयर थोड़ा रहना जरूरी है आपके वजाइनल एरिया पे। वैक्सिंग से बिल्कुल आपकी ग्रोथ बहुत कम हो जाती है, तो तब आपको इन्फेक्शन होने के चांसेस बढ़ जाते हैं। तो प्यूबिक हेयर होते हैं तो हमें इन्फेक्शन, एकदम बैक्टीरियल इन्फेक्शन जल्दी से नहीं होता है। सो डॉक्टर यही बोलते हैं कि आपको वैक्सीन नहीं करवाना चाहिए। सो यू कैन यूज लाइक यू कैन शेव, बट शेविंग इज बेटर देन वैक्सीन, जस्ट फॉर लाइक इसके लिए आपके इन्फेक्शन जल्दी नहीं हो आपको, है ना। प्रोटेक्ट करते हैं हमारे हेयर, तो हमारी बॉडी को प्रोटेक्ट करने के लिए, है ना। सो दैट्स व्हाई देयर इज नो नीड टू लाइक रिमूव इट कंप्लीटली।
Okay, ma'am, thank you.
एक्सक्यूज मी मैम।
यस,
मैम अगर पीसीएस और पीसीओडी दोनों नियम अगर फिर भी पेन का रीजन क्या हो सकता है?
पेन का रीजन हो सकता है कि आप कुछ फिजिकल वर्कआउट नहीं कर रहे हो, आपकी डाइट प्रॉपर नहीं रहती है, आप अच्छे से नहीं खा रहे हो, टाइम पे नहीं खा रहे हो, आपकी डाइट पुअर है, अच्छा हेल्दी खाना नहीं खा रहे हो, और मेनली फिजिकल एक्टिविटी आपकी कुछ नहीं है तो भी पेन ज्यादा होता है पीरियड्स में।
मैम इसके लिए मेडिसिन लेना जरूरी है?
जरूरी तो नहीं बोल सकते। इफ द पेन इज मैनेजेबल देन यू कैन अवॉइड मेडिसिन, राइट? इफ यू आर एक्सपीरियंसिंग लाइट पेन एंड you can't manage it, then you should take medication under the guidance of doctors. Just ask your gynecologist like what medicines I should take. I'm experiencing pain, and if the pain intensity is a lot, then uh, once you need to visit a doctor, right? They
ओके
will do one ultrasound, and it would be clear like कुछ प्रॉब्लम तो नहीं है इन जनरल। तो एक सोनोग्राफी वो करेंगे तो पता आपको चल जाएगा। अगर बहुत ज्यादा हमेशा बहुत ज्यादा पेन रहता है, फर्स्ट स्टार्ट लाइक वर्क ऑन योर लाइफस्टाइल, अपने ईटिंग हैबिट्स एंड फिजिकल एक्टिविटी पे ध्यान दो। आफ्टर देन ऑल्सो यू आर रियलाइजिंग कि अभी भी पेन इंटेंसिटी कम नहीं हुआ है, देन यू नीड टू विजिट अ डॉक्टर। तो डॉक्टर को बताओ, क्योंकि एंड्रोमेट्रियोसिस के बारे में मैंने बताया, उसमें पेल्विक पेन होता है, राइट? तो अभी ऐसा मैं इसलिए नहीं बता रही हूँ, जस्ट टू डराने के लिए नहीं बोल रही हूँ। जस्ट आप पहले तो अपनी लाइफस्टाइल पे काम करो। स्टिल यू फील लाइक दैट द पेन इज नॉट लाइक द पेन इज सेम, देन आपको एक बार डॉक्टर को दिखाना है। तो क्या अर्ली एज में कोई भी प्रॉब्लम होती है तो यू विल स्टार्ट मेडिकेशन एंड बहुत जल्दी उसका इफेक्ट हो जाएगा। सो इट्स बेटर, कोई भी इरेगुलर पीरियड है या फिर इरेगुलर पीरियड के साथ पेल्विक पेन बहुत ज्यादा है आपको, है ना, तो
यस
आपको एक बार डॉक्टर को विजिट करना चाहिए। फर्स्ट तो आपको लगता है लाइफस्टाइल ही सही नहीं है, तो पहले तो उसको उसको इम्प्रूव करो,
यस
उसके
मैम।
बाद में देखो कि स्टिल इट्स देयर, देन यू नीड टू विजिट अ डॉक्टर।
ओके मैम, थैंक यू।
हर्षिता मैम, यहाँ मैं भी ऐड करना चाहूंगी। निकिता, ड्रिंकिंग प्लेंटी ऑफ वाटर कैन हेल्प दिस आउट। अगर आप बहुत सारा पानी और लिक्विड इंटेक करते हैं तो ये पेन का जो इनिशियली, जैसे मैम ने ऐड किया है, अगर बहुत मेजर नहीं है और ये बेरेबल है, तो आप पेन में सबसे पहले पानी पीना स्टार्ट करें बहुत ज्यादा। बिकॉज डिहाइड्रेशन कैन थिकन द ब्लड, और वो है ना, मेकिंग इट हार्डर फॉर द बॉडी टू सर्कुलेट, और थिकन जो ब्लड होता है ना, वही पेन का सबसे बड़ा कॉज होता है। तो ड्रिंकिंग वाटर कैन हेल्प विद ब्लड फ्लो, और आप इसमें बहुत ज्यादा ज्यादा लिक्विड इंटेक करें। सभी गर्ल्स जो सुन रही हैं, तो ड्रिंकिंग वाटर कैन हेल्प फ्लश आउट टॉक्सिन्स आल्सो एंड प्रिवेंट यूरिनरी ट्रैक्ट इन्फेक्शंस आल्सो। So drinking in a lot of water can help it out.
यस मैम,
Harshita
थैंक
ma'am, thank you very much. Seriously, a wonderful session it was. Thank you, Harshita ma'am. Dr. Mukta this side. Thank you.
Thank you so much, ma'am. I hope this session would be helpful for students.
Seriously, wonderful, wonderful.
Thank you
Sushma
for
ma'am,
having me. Yeah.
it's over.
Thank you, Miss
Over to
Harshita.
you.
Yeah, thank you, ma'am.
You
Thank
are
you, Miss
welcome.
Harshita.
Most
Thank you
welcome.
so much for this enlightening webinar on menstrual health. Your insights have been truly empowering, and gratitude to Dr. Mukta, Principal of Hermann Minor Degree College, and Inderpreet Ma'am, the Principal of SOS Nursing College, for their support and collaboration. Our sincere appreciation also goes to the Global Hunt Foundation for their invaluable contribution to this initiative. Thank you so much. Lastly, thank you to all attendees for your active participation, making this session impactful. Let's carry forward the knowledge shared today. Thank you. Thank you so much. Thank you, all of you.
Thank you, Dr. Sushma. Thank you, Nitin sir.
Thank you, ma'am.
हाँ